Welcome to Autism ADHD TV. It is the place to be for parents and professionals. I'm your host, Holly Blanc Moses, the mom psychologist who gets it. We dive into all kinds of important information like behavior, social skills, and learning. All right, let's get started. Thank you so much, everyone, for joining us today. We have an extra special podcast episode on puberty. I am so excited that Professor May has joined us today. So I'm going to go ahead and introduce her. She is a consultant pediatric endocrinologist and honorary associate professor at the University of Liverpool, UK. She is an active researcher with over 250 publications and has presented at more than 150 scientific meetings. She's the author of A Journey with Brendan, documenting life with her autistic son as both a mother and a pediatrician. She is also the author of Me and My Hormones, What Can Go Wrong, a book that explains the complex science of hormones and how hormones affect our health, well-being, growth, and puberty. Welcome. I'm so glad you're here today.
Thank you so much for having me, Holly.
We are going to be talking about a sensitive topic today. So for those parents who are watching or listening and have your kids with you, you may want to stop it right now and come back to it and review it prior to sharing it with them, just in case they're not quite ready for the information. Okay, are you ready to dive in?
Yes, definitely.
All right, let's do it. Tell us about normal puberty. How does all of that work?
So I'll talk about what normal puberty is and when it starts and what we notice when our children starts to go into regular puberty. Now, the age of starting puberty can vary. In girls, it's usually from about 9 to 13, and in boys, similarly. Girls can start early puberty at 8 years old, but any sort of particular signs of puberty like pubic hair or breast development before the age of 8 should probably be checked out by the doctor. And the first signs of puberty can vary as well. In girls, we might notice breast buds. These are signs. I'll talk about symptoms later on. But signs such as breast budding or the first signs of pubic hair are usually the mark of the start of puberty. And in boys, we will notice increase in testicular size as well as pubic hair as the first early signs of puberty. Now, sometimes carers and parents and children might notice symptoms of puberty and other things such as body odor, facial acne, greasy hair, and very commonly mood swings. We also notice growth spurt, which is the biggest change in height gain during pubertal years. And in girls and boys, that can vary. Girls tend to have their growth spurt a little bit earlier than boys, around 10 to 12, and in boys around 11 to 13. And if anyone sort of falls outside of this range, for example, having too early the signs of puberty or delayed puberty, having no signs beyond the age of 13 for girls and beyond the age of 14 for boys, then again, we as endocrinologists would recommend that you get it assessed by your local doctor. So hopefully that's a little bit of a snapshot of what normal and regular puberty is.
Definitely, and thank you for that. So what happens with hormones during puberty?
Well, hormones during puberty comes from messengers. Hormones are little messengers and proteins that affects all our body organs. And during puberty, our brain wakes up, I suppose. We have a master gland called the pituitary gland in the brain, and it starts sending messengers. We call this LH luteinizing hormone, or FSH, follicle stimulating hormones. And these little messengers somehow wakes up at around the right age ranges, and it sends messages to wake up in girls the ovaries, and in boys the testes, to then produce hormones in girls, estrogen, progesterone, but also androgens, and in boys testosterone. And those are the sort of hormones that wakes up the body to then go into the pubertal sort of changes that we then see.
One part of puberty, and of course it is a very important part of life, big changes. I often hear questions from parents is, how do we teach an autistic child about those changes that are happening in their bodies? Because oftentimes those changes don't make sense, or they might be frightening or confusing.
Absolutely. I mean, my own son, Brendan, was diagnosed at 2 years old. He's now 16. And for many autistic young people, when they start noticing the body changes, the pubic hair, the breast budding, it can be quite frightening if we haven't had that conversation about puberty. That is part of a normal change that they will go through. It's really important that we have that conversation so that they are not frightened or anxious about the changes in their body. In the UK, for example, sex education starts at 11 years old in schools. Brendan is in a special school, for example, and that is a little bit more difficult because his understanding of what sex education means is more literal and more immature. So for some autistic children, if it is really important to take them through what pubertal changes they'll be going through, perhaps visually. We use visual aids a lot. We use literal language. And one of the important things that I tend to tell healthcare professionals, teachers, schools is that do not substitute words. If they're going to notice pubic hair, say it as it is. The penis is the penis. It's not the little sausage or the willy. I have come across so many substituted words that it actually confuses the young person more. If a young girl, for example, hasn't been told about the normal changes of puberty that can range from breast development, pubic hair development, and eventually menstruation, it can be exceedingly frightening. I had a young patient tell me that she thought she was going to die when she started having blood stains or the first signs of menses, because she was never warned. And these are the things that we have to start these conversations early without fear of embarrassment. And my advice again is to be literal, because many autistics are literal. And, we can have resources. I'll take you through some of them that we can help autistic people understand changes to puberty. Mood swings are quite challenging as well. If we all remember what we were like as teenagers, we were all moody. And it's one of the very common signs of during the pubertal years. In autistic people, it can be exacerbated. Their anxieties and their compulsions can be heightened during pubertal years. So support is needed in those forms as well.
I'm glad that you brought up using names that make sense from the very beginning. I think that's great. And then also bring up the conversation early. Sometimes parents, and understandably so, may be putting that conversation off because they're not quite sure what to say or do. But definitely, I believe the earlier the better, because if not, it can be very confusing. Instead of understanding what's going to happen in their body and being able to identify it when it does happen. I'm also glad you mentioned regulating emotions. This is what I see primarily and definitely concern of parents and teachers and therapists is these challenging behavior that we see more often sometimes in these years for autistic children. And they have so many feelings and they may not be sure exactly how to communicate those feelings. Maybe we'll see, like you said, more mood swings, more intense behavior.
Absolutely. During pubertal years and during puberty, because hormones are heightened, people who are autistic may then develop a need for masturbation, for example. That is really common. Okay, we have to accept it. What I would advise the audience here is that do not avoid. I see a lot of avoidance because this is a difficult topic, or it's difficult to address or difficult to explain. But we also see, young people who need to have this conversation. My son, for example, he had to really have a sit down visually as well as literally to explain that, we don't masturbate during a family party or whatever it is. But
yeah, you don't want to do that.
No, but it can happen. In children with special needs or learning disabilities. But it doesn't mean that they can't do it. It's perfectly normal. Do it in what is teaching them what is private and what is public is also very important. I also see a lot of anxieties about the changes that's happening to their bodies during this time. Many autistics want to remain young. Brandon didn't want to grow up. He didn't want to have hairs suddenly growing, and he started plucking out all his pubic hair at some stage. It took some time to get him to accept that this is a normal change in his body that he has to accept. And we use lots of pictorials and pictures about puberty. And eventually, it probably got too difficult to start plucking every hair, but he accepted that. And this support is it's not a one-off discussion. We don't just have this one conversation at the start at 10, 11 years old and then expect them to grasp it all, understand everything. I think it's a continuous support, a continuous conversation that parents and carers can have at school with the teachers to support a young person and take them through puberty with the least of anxieties, I suppose.
I think that's important to have those conversations, is being very clear about the expectation. I have two boys, so we've had that conversation very early on to get them prepared. And definitely, if you are feeling the need to masturbate, where and when is this appropriate? And again, absolutely. Even before they were considering that, I thought it was important to explain. That way it's not confusing, especially when all the big emotions were coming up.
That's absolutely true. And it is not a taboo subject, isn't it? Because they are confused sometimes about their emotions, about the need to masturbate or their sexual attraction to same sex or opposite sex. All this is, running wild, I suppose, during the start of puberty. And we have to be supportive as parents and carers, and we have to educate them on what is private, what is public. We also talk a lot about online safety, and sex education at school should be covering this as well.
Definitely. Now, when you mention menstruation, that is obviously an important topic. I work with a lot of girls, and that can be distressing. Also, taking care of themselves. Absolutely. And like you said, this isn't a one-off conversation. This is how do you take care of yourself? How do you keep yourself clean? How do you explain when you're cramping or feeling uncomfortable?
Absolutely. I mentioned earlier how important visual aids are. Autistic people are more visual usually, and if that helps them to learn, then using visual aids to teach them about the stages their body's changing, or how to be hygienic, or how to use a menstrual pad, or eventually use a tampon, has to be a step-by-step pictorial sort of mode that I use. If you are in my house, you'll see that there are just visual aids everywhere. In Brendan's bathroom, there's pictorial visual aids on where he has to clean himself when he's showering, because otherwise he'll forget, it's under the armpits, it's in the groin, it's in, and how it's almost like a step-by-step, how to brush your teeth step-by-step, how to clean himself when he's used the toilet. And similarly, these are support aids that we should be using when you talk about menstruation for girls, for example. How would you use a menstrual pad? How would you use a tampon? How would you be hygienic for girls and boys when they're showering? All this is really important, but I suppose sometimes they get missed out because it's difficult. It's a difficult topic, isn't it?
It is. It is. Before we end, what are some top tips you have that we can better support autistic teenagers through puberty?
I think top tips, I said earlier, is start the conversation early. Do not avoid because of embarrassment or it's taboo subjects. Use simple language, but literal. Do not substitute body parts with your own substituted words, which can mean other things to other people. So be literal with the words that they're using. Use visual aids. I did want to show you one of these. Sometimes it's quite difficult to find good resources, but this particular book, the girl version is What's Happening to Ellie. The boy's version is What's Happening to Tom. And you can see that it is at the level of Brendan. Brendan has learning disabilities. And you can see it's quite pictorial, so don't be too shocked that Tom suddenly finds pubic hair. And it also talks about how to shave and where the hairs will be under the arms. And in certain cases, it actually talks about masturbation as well. So it is really pictorial, yeah? And sometimes these are useful because you might not be able to find it anywhere, or if the school has got access to pictorial aids or visual aids like PECs, they could produce some for you. If you find it difficult, then those were the books that I found on Amazon. Otherwise, you might have to create your own stick drawings, I'm afraid, and really make it literal. Use visual aids to help you on your journey to explaining puberty with your child.
Perfect. Thank you so much for this helpful information. I know parents are often looking to books to how can we help our child understand what's happening for them. So I'm sure that my audience will want to know more about you. How do they do that?
I've got a website, www.paedsdoc.co.uk, and in there it's got the book that I wrote about Brendan's journey, lots of top tips on everything from weaning to puberty in the chapters. And I recently published Me and My Hormones by Cambridge Publishing. And that just talks about all conditions and what is normal growth, what is normal puberty, and what can go wrong with our hormones.
Perfect. And thank you so much again for joining us today.
Thank you very much, Holly.
Take care. Bye-bye.
Bye.
Thank you for joining me today. Don't forget to click that subscribe button so you don't miss any future episodes. If you like this episode, please share it with someone. It may just be what they need to watch today. If you're a parent, I'd love if you came on over and joined our Facebook group, Autism ADHD Group for Parents. If you're a therapist or educator, come on over to our group, Autism ADHD Group for Therapists and Educators. You're going to find those links right down there in the notes. Thanks so much, and I can't wait to see you in the next episode.
All content provided is protected under applicable copyright, patent, trademark, and other proprietary rights. All content is provided for informational and educational purposes only. No content is intended to be a substitute for professional medical or psychological diagnosis, advice, or treatment. Information provided does not create an agreement for service between Holly Blanc Moses Crossvine Clinical Group, the interviewee, Holly Blanc Moses LLC, and the recipient. Consult your physician regarding the applicability of any opinions or recommendations with respect to your symptoms or medical condition or the symptoms or medical condition of your family member. Children or adults who show signs of dangerous behavior toward themselves and/or others should be placed immediately under the care of a qualified professional.